In this video, we will talk about orientation jaw relation. So, orientation jaw relation, it is basically the inclination or tilt or angulation of the maxilla to the base of cranium. For recording jaw relation in orientation plane, we need face bow. The face bow, it is a vernier caliper-like device used to record the spatial relationship between gingiomyoarthroidal joint, that is TMJ, and the base of cranium, and transfer the same to maxillary cast while mounting on articulator. Now coming on to the components of face bow. In components of face bow, first is U frame. It is the main component around which all other components are joined. Then we have the earpiece or earplugs. They are used to maintain the position of face bow, as well as they are basically used to derive transverse hinge axis. It is a imaginary line around which the condyles rotate. Then we have third is the orbital pointer. This is used as an to derive the anatomical landmark, that is infraorbital notch. Then we have bite fork. This is attached to the maxillary rim. Then fifth we have condylar rods. Alright, now these are the components of face bow. Now coming on to the types of face bows. There are basically two types of face bows. One is arbitrary and another one is kinematic. Arbitrary and kinematic. Now the basic difference between arbitrary is that it records the transverse hinge axis arbitrarily. That is, it is not the accurate representation of the transverse hinge axis. It records the transverse hinge axis around in the periphery of 5 mm around the condyle. However, when we will do the teeth setting, the error of 5 mm around the condyle will lead to an error in the cuspal inclination. So that error is corrected by selective grinding during denture insertion procedure. Whereas kinematic, it records the transverse hinge axis accurately. Now, arbitrary face bow is mostly used in edentulous patients, and kinematic is used in patients who require full mouth rehabilitation or in dentulous patients. Now, a question arises, why do not we use kinematic in edentulous patients? Because the procedure is highly costly and time consuming, plus the age of the edentulous patients is higher, so high patience is required in the patient, which is usually absent. So, in this arbitrary, what we see is we can only record the orientation jaw relation by the face bow transfer, but whereas in kinematic, we can record orientation as well as the centric relation. Alright, now after the types, we will talk about the indication and the contraindication of using a face bow. In indication, when the cusp and cuspal fossa relation has to be achieved. When vertical jaw relation has to be changed. Third is when the occlusion, balanced occlusion, has to be achieved. All right. Uh, Fourth, when interocclusal check records have to be made. Now, in contraindication, when we have to create monoplane occlusion, we will not use Facebook transfer. Second is when there is no intended change in vertical dimension of at occlusion. Third is when we have an articulator that does not accept the Facebook transfer. Now, Facebook transfer is mainly accepted by class 3 and class 4 type of articulators. So, this is the basic difference between the types. One more difference is that in the arbitrary, the bite fork is attached to maxilla, whereas in kinematic, bite is attached to mandible. Now, another thing that you must remember is the examples. In arbitrary, we have fascia type. Then after fascia, we have the dentatus type. All right. Then we have, yes. So now coming on to the how to record and transfer the Facebook. So first of all, what we will do is we will insert the maxillary occlusal rim is attached to the bite fork. First, we will contour maxillary occlusal rim inserted in patient's mouth and contoured. All right. So after attaching the maxillary occlusal rim and the bite fork, we will achieve a parallelism and we will center the attached bite fork. After this, the U frame supported by two fingers is recorded, inserted to the stem of bite fork. Now over here, after we put in the maxillary occlusal rim, we have to do a step in which we mark a point. A point is marked 13 mm from tragus of ear, that is canthotragal line is marked. Now after U frame, condylar rods are unlocked. The condylar heads are placed in patients and condylar center is marked. After unlocking the condylar rod, now we will use the third pointer, that is the orbital pointer. So third pointer is adjusted. First of all, we will feel the infraorbital notch, and then we will adjust the third pointer and adjust the third pointer accordingly. Now the condylar readings, they are equalized on both sides. Screw is tightened, locking screw is tightened. Entire apparatus is in position. Then condylar rod, orbital pointer, bite fork, they are checked for parallelism, movement, and alignment. Now we can also use the contoured mandibular occlusal rim for stabilizing the record. Then the face bow is removed from the patient by loosening the screw. Now we will transfer to the articulator. Transfer to articulator. First we will zero the articulator. Zeroing of articulator. Now in this horizontal condylar inclination is set to 40 degree. Bennett angle is set to 20 degree. After this we will mount accordingly, and then the plaster is mixed and mounted, and thus the recording of orientation jaw relation is done. So just to sum up, orientation jaw relation is the inclination of the tail to, or the angulation of the maxilla to the base of cranium. Then secondly, the face bow, it is a caliper like device which is used to record the spatial relationship between the TMJ and the base of cranium, and then transfer the same to the maxillary cast while mounting on the articulator. Now components: U-frame, earpiece, condylar rods, orbital pointer, bite fork, and locking screw as well. All right. Now we will mention the functions of all of the components in arbitrary, and then there are two types: arbitrary and kinematic. In this, the in examples, instead of dentatus, you should mention slide-matic, face bow. All right. Then we have two types: arbitrary, kinematic. Kinematic will record the transverse hinge axis accurately, but this will record 5 mm around the condyle in that periphery, and it is corrected by selective grinding during denture insertion. Arbitrary for edentulous, and for full mouth rehabilitation dentulous patient, we use kinematic. Orientation jaw relation is derived from arbitrary orientation as well as the central relation from the kinematic. Then the bite is attached to maxilla in the arbitrary and to mandible in the kinematic. Now, important to remember here is that we use arbitrary type of face bow for usual records, and we do not use kinematic face bow record. Then indication when we have to get the proper occlusion with cuspal and cusp fossa relation. Then when vertical jaw relation, vertical dimension at occlusion has to be changed. Also when we have to achieve balanced occlusion, and intraocclusal check records have to be checked. Now contraindicated when there is monoplane occlusion and no intended change in the vertical dimension at occlusion and articulator, that does not accept the face bow transfer, that is class 1 and class 2 type of articulators. Now this is the steps of how to use a face bow. First of all, we will put a maxillary occlusal rim, then we will contour it, then we will attach the bite fork to the rim. After attaching the bite fork to the rim, we will mark a point 13 mm from the anterior to the tragus of the ear, that is, we will make a canthotragal line on both the sides. After that, we will attach the U-frame. After U-frame, we will use the condylar rods and we will equalize them on both the sides. Alright, then we use a third pointer infraorbital notch, we field it, and then we place the orbital pointer towards it. Then we take the condylar reading, and then the entire bite fork, and they are checked for three things, that is parallelism, alignment, and movement. All right. Then we can also use the mandibular occlusal rim for the stabilizing the record. Then we loosen the screw and face bow is transferred, and then we use the articulator mounting procedure. Now there is one more thing that you must remember. According to Lazari, he said that the face bow record aids in securing anterior and posterior cast position with relative relation to the condyles of mandible. Then it also acts as an aid in vertical positioning of cast on articulator. Then it assists in completely transferring the inclination of occlusal plane to articulator. Now, one more thing that you must remember is that the orientation jaw relation, it is recorded in the sagittal plane. Recorded in sagittal plane. So this completes orientation jaw relation. In the next video, we'll talk about vertical jaw relation. Thanks for watching.